Hey, SWMOTA group, I realized I wasn't able to share the pediatrics, the Southwest MOTA Association meeting that we had on Tuesday, the Zoom meeting. So I'll just read a couple of the notes that I have. Sorry if I have to look at it because I was trying to write fast and listen at the same time. So it was pediatric settings, how COVID has impacted them, and identifying barriers with pediatrics and solutions. So the first question was the biggest barrier now with COVID, and there was families that are canceling a lot, or that were canceling a lot because of not being able to make the sessions or not be able to accommodate the face mask wearing during sessions. And providing home services if you can't get into the home or if they don't have internet for telehealth, or providing certain activities or toys for children because they are either porous or they just don't have those certain toys at their house. Schools being closed was an issue. Professor Ali Blount, she brought up because obviously it's harder to give services when there aren't children at schools. So that was one of the things that she was touching on. And rural schools that would be opening again if they didn't have internet or didn't have iPads or ways to connect telehealth to an OT was kind of difficult. Relaxed guidelines in different areas where they don't think COVID is an issue would be an issue for the therapist because it's if they aren't social distancing, if they aren't doing what they need to do, then it's hard to give therapy. Also, for people who were being very strict with the COVID measures, having the therapist be so far away, which is fine, but not being able to be very descriptive or very a little bit more hands-on with the type of therapy that was going on in that session was also a very issue that they were talking about. There was a lot of anxiety associated with COVID, so some parents were just, like I said, canceling. They weren't even trying to have therapy at all because of fear of what the exposure could be from the client and the therapist. Some solutions inside inpatient would be allowing younger individuals to not have the face mask because of closed off areas, which would benefit children with autism, especially with the sensory that the mask would be prohibiting if it's something that having the mask on and the not being able to have therapy because all they're doing is messing around with the mask, or vice versa. If the therapist has a mask on, then the client, and this is outside of autism, but the client, if they're just a younger client, would be just messing with the mask the whole time, and it'd be tough to get therapy time in because of that. So they were implementing the clear masks that are clear over the face, or the visors. Habits that have changed for the OTs, ways or different toys that they're bringing with them that they can clean on the spot, or giving parents a step-by-step way of making the toys or making the different activities for the individual so they can have it at the home, and all the OT has to do is show up with a plan or show up with certain things that they could do to manipulate that toy, and trying to coach parents in different situations so that they can know how to do the therapy, but understanding not trying to overwhelm them, because the children have now, a lot of them have gone to homeschool and the parents have to facilitate that. They asked about caseloads in schools. Professor Ali was saying that they're low because the kids are pulling out of school or not going to school. Outpatient has seen both an uptrend because parents are noticing that there are certain things that need to be taken care of. When the children are at home, they actually notice certain aspects that therapy has helped out with. And they talked about an uptrend of patients and seeing more issues with current clients because possibly the parents weren't as aware. Now that they have more awareness at home, they can actually target different portions of issues that the child might be going through. Jordan Valley says that their PCP is saying to go to therapy, or they've been getting more therapy because school needs haven't been met. So what hasn't been being met at the school area where Professor Alley would be at, that would be supplemented with more inpatient therapy. A change in interaction or one-on-one interaction was asked. Has there been anything like that? And obviously the masks is tough to have communication, but not many changes other than that. Change in facilities and meetings, and there's been a shrink down in terms of how they have communicated meetings. There'd be one person from department, whether it be from the school or from Jordan Valley or from inpatient. Outpatient, that hasn't been seen that much, and the outpatient clinic is the First Steps program that was on the call. There's been a lot of IEP meetings on Zoom, which is something that we're all pretty much used to. There was a question about tech use, more or less. Jordan Valley says a lot more. They use this program called TYTO, Tyto, and it helps with telehealth, and that's something that they've currently been implementing a lot more use of cameras and a lot more use of telehealth. So booths that have been sprayed down, have plexiglass and everything like that. Those have been used more. Sensory equipment was hit hard in terms of not being able to use that. So that type of tech use has been limited because of not being able to clean it as much, or your sessions are so close together that you don't have time to clean them quickly enough between clients. A question of any other PPE besides masks is being used, and mainly just having a change of clothes, because when you're going from patient to patient, you don't know if one has been exposed to COVID or not. So if you're on the road, like First Steps was saying that she would actually change it in gas stations a lot because there wouldn't be somewhere to change. You're not gonna change in the car. Maybe for a dude, I've done it a couple times, but for females, I probably wouldn't recommend changing in your car. So having that in case there's children spit up or anything like that, that is one of the changes that they've seen. With guidelines, our interactions still occupational and client-centered, and all of them said yes. It's actually been more client-centered and more occupation-based because education per the client and education per the parents. So self-care has been a huge task that has been taken on. Finding out what parents what parents have been focusing on with their children, and then being able to focus that on their therapy sessions has been a large bit of their client-centeredness. That way they can get what the parent sees day to day and then tailor that and not necessarily have to go into referrals or past sessions that were non-COVID to see if anything can work during this pandemic. There's been a increase in education on social distancing and providing direction. And they had a question of the projection for the future or vision. Has anything like that been implemented? And there's accountability for therapy units. So to make sure that enough therapy has been going into the client sessions, and not just like having to explain the whole COVID thing every time, or having to worry about a mask being pulled or a client not really understanding what's going on. So a projection for the future that they were saying was just to make sure that the accountability was being there, and when they're exposed, to definitely take the quarantine seriously, quarantining so you're not spreading anything, and getting tested. I had a question if therapists had to be tested based on the amount of clients they had, like in terms of volume. After certain many clients, do you get tested? They said no, just in case if you feel any type of way, then get tested. And then to make sure, First Step said that when other clients did test positive and other therapists were with that client, but because they had shared some of these same tools, and even though they were cleaned, they didn't know what was passed and what wasn't. So those 3 therapists that had seen that client or had some type of interaction were quarantined for 14 days, and that tends to kill the caseload and pushes everything back. So that's what I got out of it, and this has been 10 minutes of your time. Hopefully it wasn't too bad.